all the studies have also shown that SMILE gives better stability of results as compared to all other laser refractive procedures. And it's a very pain-free, scare-free experience. And I am best at doing SMILE. My results are excellent. I'm confident with the procedure. The guarantee that I have with the procedure is unmatched. And so this is my preferred procedure.
Are the results of SMILE long-lasting?
Of course, I think it's the most, all the studies have also shown that SMILE gives better stability of results as compared to all other laser refractive procedures. Even for high errors, high cylindrical errors, I would, in my experience, feel that SMILE gives extremely long-lasting results.
What do your patients love more about the SMILE experience?
So in our clinic, we have this entire process and routine set in. When a patient comes in for SMILE, we take them through every step that's going to happen inside the OR beforehand. Even while we're doing the procedure, I talk throughout the procedure at every step. They are the communication is, I think, a lot, and that makes the patient is comfortable, relaxed, and it's a very pain-free, scare-free experience. And we actually show the procedure live outside on a screen. So the quick time taken and as well as the comfort of the procedure, and the patient feels like he's cared for even after the procedure, all the instructions I explained in detail. So I think the process that we have in our clinic makes it extremely comfortable for the patient.
What do your patients love most about the SMILE experience?
So in our clinic at Medilaser, the whole process, the rhythm of it is so beautiful. Like when a patient comes in for SMILE, we take the patient through every step that's going to happen inside. Even inside the theater, I talk, I ask questions, I distract the patient, I'm usually chatting. So it's a very comfortable, easy, pain-free experience for the patient. So after the procedure also, all the instructions that are given, there is a genuine amount of care and affection that the patient experiences, and I think that is most special about SMILE at Medilaser.
How much follow-up patients typically need after the SMILE?
If the patient is here available in the city, then we usually see the patient the day after, a week later, and a month later. But honestly, we have a lot of patients who come from outstation. They're not in Pune, they're leaving the country, and then we would still be okay with a day after, and then a week or two after, and then probably once a year follow-up.
Is there any age limit for undergoing SMILE?
So there is a lower age limit, we would not do it younger than 18 years. But even between 18 to 21, there's a gray zone. We wait for the refraction to be stable. Only if the patient has a medical requirement, he has some fitness criteria, we would do it at a younger age. But usually after 2021 is the time we would prefer to do it. And there is no honestly defined upper age limit. I've done SMILE even for 55-year-olds. I've had so many parents of patients who are we are ready for reading glasses, but we don't want this -8 number. So if looking at the rest of the criteria, the willingness of the patient to, wear reading glasses or have a monovision, if the patient doesn't have a cataract, so there's no upper age limit actually. It's at the surgeon's discretion.
Do you personally recommend SMILE to your patients?
Because honestly, I'm a refractive surgeon. This is all I do every day. And I am best at doing SMILE. My results are excellent. I'm confident with the procedure. I can, this is how it is driving for most of y'all. Doing SMILE, the ease, comfort, confidence, the guarantee that I have with the procedure is unmatched. And so this is my preferred procedure of choice for most refractive surgeries that I do. Until and unless the patient is not eligible for some reason, only then I would recommend another procedure for the patient.
What is the most common myth about the SMILE that you want to bust?
There are so many myths actually. Number one is that you can't do it for low errors, which I think is not the case. I've done it even for a -1 diopter myopia, or that SMILE is not for high cylinders. I've done it for -5 diopter cylinder. So SMILE can treat the whole range of refractive errors. A lot of places where they do not offer SMILE say, oh, you have just a regular error and you don't need an advanced procedure. You can just do the regular LASIK procedure. SMILE is not required because yours is an easy, straightforward case. But I think that is a myth. SMILE is for everyone. If your error can be treated with SMILE, that should be your first choice. So after all these questions that we've had today, I think I've gathered that you all shouldn't wait and ask your friends, relatives as to what procedure to do, and ask Google and ask ChatGPT for which procedure is best for you. I think you all need to visit an expert, a refractive surgeon where all the facilities are available under one roof. Go book your consultation now with Medilaser and come see if you're eligible for SMILE.